This is Annette Nakayenga, who together with her 17-year-old daughter from Rabalega landing site in Bwendero, sub-county, Kalangala district, who say they are living with HIV. This mother-daughter family say they had lost hope.
I had lost hope when I contracted HIV. I would miss my medication.
Life had a turnaround when health community workers stepped in, offering support and guidance on positive living, taking ARV's medication on time, and follow a health routine.
With the help of the Catholic Church and TPO, I started up a piggery farm and my daughter is now a tailor. Our lives have changed.
Masaka Diocese, through its medical arm working with Transcultural Psychosocial Organization Uganda, works with such vulnerable communities. Here, HIV-positive children, caretakers, and other vulnerabilities are prioritized to improve lives, as Father Emmanuel Katabazi explains.
Of course, the major impact is improving on the viral suppression. I remember some time back when we had just started working in Kalangala, the children who were suppressing were around 76%. But as I talk now, I can see a big improvement.
It was then that the duo started to regain control over their health. With newfound strength, Nakayenga poured herself into building a future. Today, she owns a flourishing tailoring shop and also runs a piggery farm, improving her income and becoming a living testimony in her community. Nakayenga and her daughter's story is not just one of survival, but of a thriving testimony that shows life full of possibilities, especially after the two were able to suppress their viral load and attaining positive living. Kalangala District Vice Chairperson Restin Nakawungu reveals that social workers in the area have registered at least 250 children who are living positively, a number they see as too high. However, after different interventions, like prevention of mother-to-child transmission, there is hope that the number of children born HIV positive will reduce.
New child born, they don't need any infection. They are sensitized, they are worked on, they are advised to attend ANC, the mothers, and deliver at the health facility.
We, as leaders and the caretakers, we need to continue with this message and advising them to adhere to the instructions that are given, so that there is no relaxing on taking ARVs and even taking care of not contracting the disease.
Island areas are known as hard to reach given the nature of the terrain, the means of transport, and the nature of the population. According to the latest census report by Uganda Bureau of Statistics, Kalangala has a bigger number of men compared to women, which makes it an epicenter for HIV/AIDS transmission and therefore a critical area for improved service delivery. The country director, Transcultural Psychosocial Organization, Peter Okwi, says such innovations will create game-changing solutions and lead in the battle against HIV/AIDS in the country.
It has been a success, not just in the immediate objectives, which are facilitating, addressing, helping orphans and vulnerable children to, reduce their vulnerability, but also access HIV medication. But I think the downstream impact of the project is what happens when we leave, what happens when the project funding ends. And I think, as we have seen today, Rebecca started outlining a skill of how to make liquid soap, which she markets. So I think not just delivering on the immediate project objectives, but the broader impact to the society, to her neighbors, to her families. Rebecca is a shining example. It's also a demonstration of how partnerships work.
SSENYONGA MULINDE, NTV Weekend Edition.